Doctors' offices closed, operations postponed. A strike of medics in France is gaining strength, with general practitioners on a 2-week work stoppage and protest planned. They are angry at the government's latest social security budget. They say it effectively scraps the notion of equality in the French healthcare system. Well, to get more insight, we can speak now to the president of Jeunes, Médecins, a national union with over 7,000 members representing all doctors, both in hospitals and liberal practitioners. Dr. Anna Boctor, thanks so much for your time. Can I start by asking you to explain to us a bit more the demands of doctors in this strike?
We are warning about an authoritarian drift in the way they manage the social system in France. So it's very deeply worrying for us to see this drift. The Social Security Financing Act allows now, it's officially published now, it allows the director of National Health Insurance to reduce or even to delete some reimbursement for a certain type of acts of care for the patients, and it deeply impacts the hospital economy and even the private offices economy, and even the out-of-pocket costs for patients. And it's not tolerable because, you know, in France, the health is not good, and a good, a nice health system provided to population is better for us, for our economy. And there is a worldwide crisis with a lack of doctors worldwide, and the population is getting older worldwide, and it's a big problem now, and we have to discuss with the actors of health instead of getting totally not close to them.
Yeah, I have had a bit of a look. I mean, France still has a reputation of having one of the best social security and health systems available to patients, but I've had a look at the budget. It does say that reimbursements could be cut for both treatments and prescriptions from certain doctors. Have you been given, though, any indication as to what specific things could be no longer eligible for reimbursement? Is there any lines that you can work on, or is it a bit haphazard? How will it work going forward, do you know?
Normally, the prescriptions are reimbursed because of their medical
justification.
It's useful. Yeah, it's useful for people. But now this text allows to delete this reimbursement depending on the prescriptor. So it's not logical, it's only punishment, and it's not good for health of the population.
So it depends on the doctor that prescribes it. Certain doctors' prescriptions will not be reimbursed, and what doctors' prescriptions will not be reimbursed?
The doctors which are not in the convention with the National Security Insurance.
So more the private, often the more expensive doctors.
Yeah. There are a few doctors. It's very, very few doctors, but it allows us to have, pressure on the National Health Insurance if they don't respect care providers, and we can go out from this convention if it's not good for us. And now they want to kill this possibility and to delete this kind of pressure from us, and it changes totally the relationship between us. So it's authoritarian drift.
Okay, so you fear that more freedoms, if you like, are being taken away from doctors, but it's a lot of doctors that are part of that convention that are on strike this week and next week.
We are on strike during more than 10 days now because we are warning against this authoritarian drift. There is other articles in this text which are deeply worrying, like the article which gives total power to the director of National Health Insurance in France to delete or to reduce reimbursement for people, and even the ministry. And before that, it used to be discussed with the representatives of national care providers in France, and now they don't. They are sitting on this kind of social dialogue.
It sounds like it could become somebody sitting in an office that doesn't have direct contact with the patient that is making cutthroat decisions. Can I ask you before we leave you? Is it all about this social security plan that also curtails sick leave in France? But is it also perhaps about the working conditions for doctors in the country? I know there was demands last year and the year before for payments to be increased slightly for doctors, also for the paperwork to be reduced.
It's not really the matter for us doctors. We chose this job to take care of the people. So if you see every day people are not getting better in their health conditions, it's not good for us, and it doesn't make sense for our work. So what we are warning about is having a real vision of public health, which can be very good for economics and for the health indicators, which are not good in France. We had the highest rank in infant mortality in Europe, and even in cancer incidence. And we are carrying an abyssal level of public debt and one of the highest tax burdens in the world. So it's not satisfying. We need a real vision, a good vision of public health, to improve the economics and the health indicators in France.
Dr. Anna Boctor, we'll have to leave it there, but thanks so much for joining us and bringing us more insight. Very much
Thank you.
appreciated.